next bone, which is the scapula. So the scapula, regarding the site, it is the bone that forms the posterior part of the shoulder girdle. So as I mentioned here, shoulder girdle is formed of shoulder girdle or pectoral girdle is formed of two bones. One bone that lies anteriorly, which is the clavicle, and the posterior one, which is the scapula. So the scapula is the posterior bone of the shoulder girdle. Exceptionally, away from the remaining bones of the scapula is in the form of flat bone. Regarding the shape, it is a flat bone, not long bone. This is why I cannot apply the fixed rules ends and shaft in the clavicle, because it is classified as a flat bone. It is in the form of inverted triangle, as its apex is directed downward and its base is directed upward. So for descriptive purposes, we can describe the scapula, general features of the scapula, as the following. Three angles for the scapula. This one, which is the inferior angle, and this one, which is the superior angle or medial angle, and this angle is the lateral angle. And this angle has a specific name, which is known as glenoid cavity. And this glenoid cavity, for the articulation with the head of the humerus to form this joint, which is known as shoulder joint. Shoulder joint. Next, scapula has three borders. So again, three angles and three borders. This border is the medial border of the scapula. This one is the lateral border of the scapula, while this border is the superior border or the upper border of the scapula. So again, don't forget that the clavicle is in the form of inverted triangle. So three angles, three borders, and two surfaces. This surface, which is the anterior one, which is known as anterior surface of the scapula or ventral surface of the scapula or costal surface, because of this surface facing the ribs. So that as this one. So here, this surface, that because of that, as I mentioned, costa means rib. So because of this surface facing the ribs, this is why this is known as costal surface. And because of that, we have a specific muscle inserted or attached to this surface, so it is sometimes known as subscapular fossa. Word fossa means depressed surface. So because of that, this surface is depressed. This is why this surface is known as subscapular fossa. So what are the names of this surface? Anterior surface, ventral surface, costal surface, or subscapular fossa. Posteriorly, so we have this surface, which is known as posterior surface. This posterior surface is divided by this bone, as I will describe later. This part of the scapula is known as a spine. So the posterior surface is subdivided into these two fossae. Fossa singular, the plural is fossae. And because of this fossa, which is the depressed surface above the spine, this is why it is known as supraspinous fossa. And this fossa, because it lies below this spine, so it is known as infraspinous fossa. So again, scapula has three angles, three borders, two surfaces, anterior and posterior or dorsal surface, and the three fossae: subscapular fossa, supraspinous fossa, and infraspinous fossa. And it has also three processes. This process of the scapula is known as coracoid process. This process is coracoid process. This process is the acromion process, which is sometimes palpable above the shoulder joint. And this process is the spinous process, which is also palpable. So the spinous process expands laterally to form this process, which is the acromion process. So again, scapula has three processes: coracoid, acromion, and the spine, that which is in the form of a shelf that projects posteriorly. And the scapula also has two notches. This notch, which lies in the upper border of the scapula, which is known as suprascapular notch. What's the meaning of word notch? Word notch means depressed border. Notch means depressed border. But because of this notch lies in the relation of the upper border, it is known as suprascapular notch. And we have another notch that lies here. This notch lies between the spine and the glenoid cavity. This notch is known as a spinoglenoid notch. And the scapula also has two tubercles. This small tubercle that lies above the glenoid cavity, which is known as supraglenoid tubercle, and this one, which is lies below the glenoid tubercle, which is below the glenoid cavity, which is known as infraglenoid tubercle. What is the meaning of word tubercle? Word tubercle means small, smooth, bony elevation. So that in relation to the glenoid cavity, we have these two tubercles. Supraglenoid, supra means above or superior. Infraglenoid means inferior. Finally, in order to finish the general features of the scapula, as I mentioned before, this is the spine. The spine has a posterior free border, which is known as the crest. So this border is known as crest of the spine of the scapula. This crest has two lips. This lip is known as upper lip of the crest of the spine of the scapula, while this one is known as inferior lip of the crest of the spine of the scapula. So what about the general the side determination of the scapula? How I can determine the side of the scapula, if it is right or left? Again, by apply the three major rules. Where is anterior from posterior? Anteriorly, the anterior surface of the scapula is smooth and depressed, while the posterior surface is characterized by the presence of this projection, which is the spine. So this anterior and this is posterior. Second, how I can differentiate medial from lateral? By the direction of the glenoid cavity. So the glenoid cavity is your indicator for the lateral side. So this is the lateral and this is the medial. Superior from inferior. We have several landmarks to differentiate superior from inferior, either by the presence of the coracoid process and the acromion process that must be directed superiorly, or the inferior angle that must be directed inferiorly. So the conclusion, this scapula now is named as right scapula. Finally, what are the joints formed by the scapula? The first joint is this one, which is the acromioclavicular joint, which is a part of the shoulder girdle or pectoral girdle. The second joint is this joint, which is the articulation between the glenoid cavity and the head of the humerus to form the shoulder joint. These two joints, as I mentioned in the beginning of this video, These two joints together form a shoulder complex. Now I